So, welcome to another episode of the PML podcast. This is Dr. Ogunsende. I'm the inventor and founder of the PML technique, as well as the PML masterclass course that we just concluded last week. Thanks for everybody that attended, and we will be bringing this to all the trained interventional radiologists, interventional pain management physicians, as well as spine physicians that are interested in learning the revolutionary technique called the PML technique for SI fusion. The course that we just concluded, actually, I had a live session of step by step surgical technique for both the conventional as well as the PML technique. So, new surgeons that have no experience with SI fusion can actually benefit from this course because it showcases both the lateral to medial technique as well as the PML technique. We were able to perform almost 2 hours of extensive teaching, both X-ray, fluoroscopy, as well as clinical. So you should be able to see all the steps necessary for bilateral posterior medial lateral SI fusion, and we placed 6 screws into the pelvis. All screws were confirmed crossing the teardrop. I always recommend getting an iliac teardrop view for PML technique because I've had several X-rays sent to me by some other surgeons where they get AP and inlet view of the pelvis, and then they get a CT scan post-op and shows the screws are actually medial to the teardrop, so not transfixing the SI joint. So the pointers I will have for you is always get an iliac teardrop view on the before you decide that you finished the surgery. This acrylic pelvis I have here, I have like 4 of this on my house. This acrylic pelvis shows the first generation implant. You can see the triangular implants. So this implants, we started doing this in 2013. They were just porous coated implants, plasma sprayed implant. They were 3D printed implants in 2017. And those ones had holes in it that allowed for ingrowth and on-growth potential. So now we've moved from this to the torque screws or the 3D printed screws. Different companies have different types. SI Bone has torque, Zovation has Cyber Tie, and then of course Globus has screws, and some other Medtronics has screws. They all have different names. As long as it's 3D printed screw, I think it's safe to use for PML because it's typically self harvesting screw, self autograph harvesting screw. So typically you don't really need a additional bone grafting. The course we're teaching is going to be available both online platform to be signed up for. We have a wait list currently for the online platform to be launched in January. We also have a wait list for the live in person one-on-one teaching course for professionals. Again, interventional pain, big target because they get to be able to perform SI fusion safely with one incision, outpatient, minimal risk, minimal restrictions post-op. And of course, our spine physicians like I am that want to incorporate SI fusion into their practice. SI fusion is a very safe surgery to perform. There's a huge demand for it. The risk factors are well known. Female in general have high risk for SI joint dysfunction. We also have, multiple children. If you have multiple children, you have a higher risk because the ligaments become loose. When you look at the structure here, the ligaments connect the sacrum to the ilium. So if the ligament here becomes loose because the true pelvis has to expand for the birth canal to be bigger, this ligaments become loose and it doesn't go back to its resting stage or resting length. So you get a little bit more movement in the SI joint. The SI joint typically moves about 2 to 4 millimeters front to back. So any movement over that causes excessive pain in the SI joint. So we have uh, people that have had lumbar fusion to the pelvis is high risk for pain in the SI joint. So if you've had screws, these are titanium screws. So if you've had screws that go to the sacrum, you increase your angular stress in the SI joint quite a bit. There's a paper by Dr. I think it's Dr. Pavlov, that was published in 2009, Journal of Spine, and that paper talks about the angular stress from the SI joint. It's about 50% for the first level, and it goes up to like 150% once you go higher than L4 through S1. So we know for sure that the SI joint becomes stressed once you have a fusion to the sacrum. So a lot of my patients that we see have previous lumbar fusion to the pelvis or to the sacrum, and they typically present with unilateral SI pain. Typically, they've been diagnosed as just failed back surgery syndrome. We found out that about 40% of patients with failed back surgery syndrome have SI pain. And actually, it's grown higher than that. Typically, failed back surgery syndrome was a big problem, and we were having to place spinal cord stimulators in their back, in patients' backs. So now we understand that of the patients that have failed back, almost 50 to 75% of those patients have SI joint dysfunction. So once you identify that and you do your diagnostic injection and your provocative test, uh, if you have a positive provocative test times 4 and injection to the SI joint, and it gives about 75% improvement of pain, those patients are good candidates for SI fusion. And typically the CPT code is 27279. Um, so we'll talk more about SI joint dysfunction in our next daily drop of knowledge. I think the more you understand SI joint pain and SI joint dysfunction, for as a practitioner, you will be able to easily diagnose these patients, and you'll find out that the PML technique, which gives you access to both SI joints at the same time with a 1 to 1.5 centimeter incision, is the way to go. Again, we have a wait list for the live in-person session. Typically, we're going to be planning to do maybe 4 surgeons uh, per weekend. Typically, we're thinking about an 8 to 2 p.m. all day didactics and lab presentation, one-on-one, hands-on, and we'll do both conventional SI fusion as well as PML SI fusion. By the time you leave to go back to the airport, you should have a full understanding of the PML technique. I'll be there, make sure you know exactly what I'm thinking and how I think through the PML SI fusion. And then if you chose to do the online course, which is 8 modules of extensive information, that is excellent for you as well. Some people may want to do both. And if you want to do both live in person as well as online platform, we'll have that available as well. So stay tuned. We'll have you can check out our website, my website, www.ogunsendemdspine.com, for more information. We'll see you tomorrow. Take care. God bless.